So I have a very interesting case of a 50-year-old male who was referred to the CT department upon complaining of left mandibular pain during deglutition, and specifically on the lower left side. I will give you a few seconds to determine the radiographic findings in this following CT. If we check this axial CT, we can determine something very surprising and shocking. Now those radiopacities can be narrowed down to calculi. The upper region demonstrates protrusion out from the gland. The mid-region calculi, if I focus on it right here, demonstrates that it is protruded on the lateral aspect of the gland, and the inferiormost calculi portion is located within the gland itself. Surprisingly, the intra-glandular ductal radicles are actually not dilated, and obviously the left SM gland seems to be much more enlarged compared to its counterpart. The parenchyma also happens to have signs of atrophy here. Now if I focus right around here, just around here, we can see that a small portion of the cervical lymph node seems to be reactive to those changes. Now if we look further, we can see that there are no pathology associated with the parotid glands or the sublingual glands respectively, nor any of the neurovascular tissues. All the muscles, including the buccinator, the masseter, the temporalis, all appear very normal and very well. The sinuses seem to be very well defined without any indications of sinusitis, and the vertebral column and the cervical vertebrae appear very normal. And if we look at the coronal CT, we can see the same radiographic findings. We can see that the superior calculi appears to be outside of the gland itself. The middle portion of the calculus appears to be on the lateral aspect of the gland, whereas the inferior calculi appears to be embedded within the gland itself. And we can check that the intraductal radicles are actually not dilated, surprisingly, but the parenchyma does show signs of atrophy. And if we look further, we can see obviously the parotid appears normal, and all the neurovascular structures appear normal respectively, along with the temporalis, the masseter, the condyles of the mandible, the sinuses, and the conchae, along with everything else. Thank you so much for watching, and I hope this video was informative.